Do you want to know more about the treatment of high blood pressure? Here is a simple explanation from a licensed pharmacist. The first approach is always to change lifestyle habits. If you're interested in what those might be, check out my previous videos. There are four main medical groups that are most commonly used for treatment. An easy way to think about it is ABCD. Firstly, we have A, which stands for ACE inhibitors. As you can tell by their name, these drugs block the enzyme ACE that produces angiotensin II. Angiotensin II is a hormone that tightens the blood vessels. By stopping this process, the vessels relax and blood pressure drops. A common side effect is a persistent dry cough. If this happens to you, consider changing your medication since the cough will likely not go away. Another side effect is high potassium. You should be aware of warning signs like muscle weakness, tingling in hands, feet, or around the mouth, irregular heartbeats, or nausea. But since high potassium can sometimes be silent, regular blood tests are essential. ACE inhibitors are often the first choice, especially for patients with diabetes or heart failure. ACE inhibitors end with the suffix "pril". Examples of commonly used substances are enalapril or lisinopril. A also stands for ARBs, or angiotensin receptor blockers. Instead of blocking the enzyme, they block the receptor where angiotensin II acts. The result is the same: relaxed blood vessels and lower pressure. Common side effects are dizziness or high potassium. They can also cause orthostatic hypotension, which means your pressure falls when you're standing or sitting up. This can cause dizziness and unsteadiness. ARBs are often used if patients can't tolerate ACE inhibitors because of the cough. ARBs end with the suffix sartan. An example is valsartan or candesartan. The B stands for beta blockers, like metoprolol, which slow down the heart rate and reduce its pumping force. They are not usually the first choice for hypertension alone, but they're useful if the patient also has heart disease, arrhythmias, or previous heart attack. Side effects include fatigue, which could be long term, cold hands and feet, and nightmares. In some cases, they can cause breathing problems in asthma patients, so they should be used cautiously with asthmatics. The C in ABCD stands for calcium channel blockers, CCBs, which prevent calcium from entering muscle cells in blood vessel walls. Without calcium, the vessels can't contract as strongly, so they stay relaxed. A common side effect is swelling in the ankles, headaches, and facial flushing. CCBs are especially common in older patients and are a frequent first-line choice. They end with the suffix "dipin", and a common example is amlodipine. The D stands for diuretics, which help the kidneys get rid of salt and water. This reduces blood volume, lowering blood pressure. Side effects include low potassium and increased urination. They're simple, effective, and often used in combination with other drugs. There are different groups of diuretics. A commonly used one is thiazides, and a much used example is hydrochlorothiazide. These drugs can elevate levels of uric acid, which can cause or worsen gout. Another type of diuretic, called spironolactone, saves potassium instead of lowering it. This diuretic can also cause hormonal side effects, so make sure you know the difference. So, which drugs do doctors usually start with? The main four are ACE inhibitors, ARBs, CCBs, and diuretics. Beta blockers are used more selectively. Note that when the blood pressure is lowered, the body needs time to adjust, which can result in fatigue, dizziness, and weakness, regardless of what medication you're using. These side effects will in most cases pass after a couple of days to a few weeks once the body has had time to adjust. If you suffer side effects and feel like quitting, make sure you first consult your doctor since there are many options to try. It's also important to remember that lifestyle changes like reducing salt, exercising, and quitting smoking are always part of the treatment. To sum up, antihypertensive drugs work in different ways. Some relax blood vessels, some reduce blood volume, and some slow the heart. Each has its own side effects, but together they help millions of people live longer, healthier lives. Thanks for watching, and don't forget to subscribe for more medical explainers.